This is our 14th annual gala. How about that?
Well, this is a wonderful evening. It's so gratifying to be here with many, many friends.
I'm so excited to be a part of a bigger thing, and philanthropy will mean the difference for Pullman Regional Hospital.
We have 550 employees as part of Pullman Regional Hospital and the clinic network.
You know, our hospital has some great records and obviously great staff, and it has astonishingly low infection and readmission rates, and that is really a fine mark for a hospital to have.
We're blessed to live in a great town, as you know. Pullman, last year in 2019, was voted as the best place to live in the state of Washington.
Let's just give applause for that, for all the nurses, for all the docs, for everybody doing the right thing.
Now to growing concerns about the deadly coronavirus.
More than 200 confirmed cases of coronavirus, it's called.
As of now, there has not been a U.S. infection as of yet.
Heightened states of emergency across the nation.
How serious is this?
This is certainly not a moment for panic or high anxiety.
This is a crisis that will be with us at least 6 months.
And the virus now in all 50 states.
We're asking everyone to work at home if possible.
I also directed the Department of Health to declare a public health emergency.
1.5 million Americans filed for unemployment last week.
Shoppers stocking up on necessities like wipes and water, leaving behind empty shelves.
I think people are genuinely scared.
Parents already trying to adjust to the new normal. And we're hearing of new dramatic measures medical professionals are taking so they don't put patients or their own families at risk.
In the first couple months of 2020, it really felt like you heard the kind of global chatter of a new virus.
About January is when the information got passed around the hospital and got stateside, and we got on some kind of back channel internet things of hearing what was going on, what was coming out of Wuhan.
More international parts of the world, it was having a pretty dramatic impact, but seemed pretty distant for us. So it was really, truly business as usual.
Hearing stories of colleagues, mostly international colleagues, who were taking care of patients in northern Italy. There was an emergency physician who died after managing a patient's airway with COVID-19, relatively young and healthy. And those were the stories that I think hit home for a lot of us.
Through friends, communications of this pandemic starting, some shared videos, ordered extra surgical gowns and N95s, because my thought is keeping the ORs going the whole time. Seeing the massive amount of deaths, we knew it was pretty serious.
It was early in March. I couldn't tell you the exact date, but it was the early first week or two in March. All of a sudden, I think our governor put some restrictions on schools and daycares, and we're kind of saying, no, you got to go to online classes and all that sort of stuff. We had something that we never dealt with before.
We had docs who were thinking they might be saying goodbye to their families when they left their families to go to work.
I had a community member say, you know, Ruben, is the foundation essential in the response to COVID-19?
When WSU kind of shut down in-person education, things got pretty quiet medically for us for a long time.
And when the pandemic hit, for the first couple months, we saw our surgical volumes decrease by about 50%.
A couple of nursing colleagues and I were in Boston, and all of a sudden the governor proclaimed a disaster here in Washington state, and we went, oh my gosh, it's alive in Washington. And that was the longest flight I have ever had from Boston back to Seattle. It was right then that it was really clear that this is way bigger than I ever dreamt it was going to be.
If you lose money 2 out of the 3 or 4 months that it's slower, you tend to have a financial year that is fairly stable and you do okay. But looking and saying, okay, this is not 2 or 3 months, this could be 3, 4, 5, 6, 7 months. What's going to happen?
Where were we going? No one had the crystal ball. You know, you have all the speculations with all the senators and congressmen and governors across the states, and you're hearing one thing in one place and different in another place.
There was so much unknown that we met twice a day, every day, for a couple months. We would make a decision about something in the morning and we'd have to change it in the afternoon.
How do I make sure my staff is available all the time? How do we make sure we don't transmit it, have one person get it and spread it through the entire staff? How much staff do you have? Who could fill what roles? What do you shut down? What do you keep open?
It was so scary for our staff. It was scary that I am dealing with all these patients and then I have a family at home. What am I taking home to my family?
Dying from COVID, from the lung infection and the vasculitis and everything, it's not a good death. It's terrible.
So many of them, when they would do their stretch of shifts on, they would not spend time at home with their families because they didn't want to expose them.
How do we stay in existence to be here? In all honesty, I mean, I was looking at it saying, okay, if we've got 60 days cash on hand and we're blowing through cash quick, we're looking at October 2020 and lock the doors, folks.
People were looking to help any way they could early on. That was wonderful.
People just looked for opportunities. We were having people call us and write us and email us saying, how can we help? We want to do this.
Local restaurants gave us all kinds of food. They would have coffee and donuts and dinner, and it just meant so much to our staff.
People would send food to the folks who are working in the trailer, testing sometimes hundreds of folks a day.
So we didn't have enough masks and we didn't have enough eye protection. We had all of these volunteers in the community who made masks and would deliver them here. I don't know how many thousands of masks were donated, but it was just great.
So grateful and humbled and emotional. I got goosebumps right now thinking about it, that we had individuals that saw the need and wanted to help.
To be in a community that just really told our staff all the time, we really appreciate what you're doing, it was amazing.
It was hard, it was difficult, it was a challenge, but we were resilient.
It's almost like we've turned a couple corners. The vaccine effort was so exhilarating as a community and personally. So it was kind of a coming out of the community to see each other again and be a part of something that people saw really important and they were excited about.
Once I realized and looked at the data at how good the vaccines worked for preventing severe disease, keeping people out of hospital, that was really encouraging. Yeah, that was like, all right, you know, we're gonna get through this and people are gonna be able to go back to their normal lives.
The high point was at the end of the year, Foundation transferred over $2.3 million, which essentially was 2/3 of the amount of cash that the hospital had as a bottom line. So a significant cash inflow at a time when the hospital needed it the most.
You start reading in the paper that, you know, this group is laying off, 100 people, and this group is laying off, 1,000 people, and this group is, and we didn't have to do that.
And saying, we're not going to have any layoffs. No one's getting laid off. And I think early on when we had announced that, that was a big part of how we've weathered the storm over the last couple of years.
Yeah, I think the overall organization should be very proud of that.
We had a staff that understood what it meant to work together, what it meant to make decisions, what it meant to follow through. Our mission to provide high quality care in our community. That commitment helped get us through the pandemic and come out stronger.
The true definition of philanthropy doesn't have anything to do with what you give. It's that what you give made a difference for you and for those who you're trying to impact. When I look to the future of our hospital is bright because the future of our community overall is very bright.